Thank you all for joining us here today. I have a very important announcement to share regarding the measures to control the spread of COVID-19 in Newfoundland and Labrador. Back in the beginning of July, when our province entered the Atlantic bubble with Nova Scotia, New Brunswick, and Prince Edward Island, our government committed to monitoring the situation. Subsequently, we've seen almost 4 months of low infection numbers. The Atlantic bubble has been a source of pride, and people outside our region have taken note. I commend you all for following public health guidelines throughout Atlantic Canada and doing your part to allow for some semblance of regular life within the COVID-19 pandemic. But the situation has changed. That original directive leads us to today's decision. After careful consideration and consultation, I have made the tough decision to implement a circuit break. Effective 12:01 a.m. on Wednesday, November 25th, 2020, people arriving in Newfoundland and Labrador from within the Atlantic bubble will be required to self-isolate for 14 days. This is not an easy decision, but as your Premier, as a physician, and as a concerned father and citizen, I must do what I've promised: protect the best interests of the people of Newfoundland and Labrador. Implementing this change for a 2-week period is an effort to avoid a full lockdown. For weeks now, we have watched as the second wave of COVID-19 has gained traction and built momentum across the mainland. It felt like it was just a matter of time before it made its way east, and it has. As we have seen the numbers of infection begin to creep up throughout the Maritimes, our own alarm bells began to sound. I've spoken with the other Atlantic premiers throughout the weekend. We must be responsive now and address the situation today. This is a province-wide preventative medicine measure. We're doing this to protect schools and businesses. We're doing this to protect seniors and the most vulnerable. We're doing this to protect the economy and the freedoms we now enjoy. None of us wants another full lockdown like the one we've just been through or that others have returned to now. We are doing this to protect businesses from the possibility of another complete shutdown. Now more than ever, we need to support each other, and that means supporting your local businesses at this difficult time. We will be monitoring the situation closely to see if the 2-week change to the Atlantic bubble needs to be extended. The circuit break means all travel to and from the province will only be for essential reasons. Again, anyone entering the province from within the bubble must self-isolate for 14 days. They do not have to apply for a travel exemption to come here. If anyone within the group has particularly extenuating circumstances, making 14 days of self-isolation impossible, there will be an option to apply for testing to possibly shorten that time of quarantine. The restriction of travel to Newfoundland and Labrador from outside the Atlantic bubble remains the exact same. And let me be very clear. Rotational workers must continue to adhere to the measures put in place by Dr. Fitzgerald and her team at Public Health. This is of the utmost importance for our many dedicated rotational workers. To this group, I say that I know travel during the pandemic has been stressful enough for you and your families. But please, please, I implore you to follow the provincial guidelines. We have shown that when we do, it works, and it only takes one. We all need to work together and support each other. To that end, I encourage companies in Alberta and other parts of Canada to look at adjusting their own operations. For example, switching to a month-on, month-off schedule for our country's hard-working rotational workers would make a world of difference in the quality of their lives. It would also reduce the amount of travel across the country. Remember that if you are a rotational worker coming from an outbreak site, please remember, self-isolation means isolating by yourself on your property, physically distanced from household members for 14 days. No visitors. And if any member of the household begins to have symptoms, all members must self-isolate and call 811. Do it for your own safety and that of your loved ones. Do it for your community and for your sense of service to our province. I know this is not the news we wanted or needed as the Christmas season approaches, but let me be very clear about this. We must be proactive now lest we suffer the same fate as other provinces. Our approach to the pandemic has become a model for others to follow. We've all sacrificed a lot and have worked together to keep the pandemic at arm's length. To the workers out there doing the day-to-day jobs that are keeping this province moving during the pandemic, thank you. We all owe you a tremendous debt of gratitude. I know everyone feels a sense of COVID fatigue. I certainly do. But please, we must dig deep and stay vigilant. Respect physical distancing. Wash your hands. Wear a mask. Stay home if you feel sick. Call 811 to get tested if you think you have symptoms. Download the COVID-19 alert app. Do a virtual check-in with those around you. And continue to listen to the advice of Dr. Haggie and Dr. Fitzgerald. We are implementing this 2-week pause now as a preventative measure to stave off the second wave of COVID-19 and hopefully protect the upcoming holiday season. From Snowmageddon to the lockdown, after the year we put in, we all deserve and should be able to enjoy the holidays. But that's why it's so important to dig a little deeper now to help us all get there safely. Until then, Newfoundland and Labrador, please stay safe, stay strong, and take care of each other. Before I pass it over to Dr. Fitzgerald, I want to add one more thing. To the members of the media, thank you for always keeping the province informed during the pandemic and helping us get the message out there. Thank you. I now invite Dr. Fitzgerald to share her update.
Thank you, Premier. Good afternoon, or good morning, I think it still is. Thank you for joining us today. I'll begin with an update on COVID-19. So since the media advisory yesterday, we have 2 new cases in Western Health. The first is a male between 20 and 39 years, which is related to travel from Manitoba and unrelated to the previous cluster within Western Health. The second is a female under 19 years who is a contact of a previous case. Public health investigation is underway and contacts are in the process of being notified. The total number of cases in our province now is 321 and 294 people have now recovered. In total, we have tested 59,270 people. We have had our first case of COVID-19 in a child that has attended school. Public health officials in Western Health are investigating, and this case is related to previous cluster. I want to go through the process of what happens when we have a case of COVID-19 in a school. As with any case, contact tracing starts by identifying any close contacts of the child. This will include the school cohort or class of the child. In this case, which is an elementary school in Deer Lake, the parents of this class cohort have been notified and the children have been self-isolating and testing has been arranged. The school has been following public health guidelines by keeping cohorts separate, and this reduces the risk of transmission from one classroom to another. While this is not welcome news today, it is certainly not unexpected. We knew we would eventually see cases in schools. This was the purpose of instituting cohorts at the beginning of the school year. We have procedures in place when cases are identified in a school, and public health is working diligently to follow through with the investigation. It is important for people to remember that we have been able to link all cases in Deer Lake back to travel, and we do not have evidence of widespread community transmission in the area. This situation, however, reinforces the need for all of us to be vigilant and to understand that COVID can arise in any community at any time. We all need to follow the public health measures and practice physical distancing, reduce your contacts, and avoid gatherings of any size. We have seen that gatherings have been a significant contributor to outbreaks in the country. We really have been fortunate to live with low levels of COVID-19 for the past several months, but we need to now behave like we did back in April by assuming that COVID is here. Gatherings, while important, will need to wait until we have a significant portion of the population vaccinated. We also know that rotational workers, perhaps more than any other group, have sacrificed the most during this pandemic. For a significant part of this year, they were in a constant cycle of working and self-isolating without time to spend with family and friends. This is why we relaxed measures for these individuals, recognizing we had to balance risk with the well-being of these individuals and their families. We continue to carefully consider the balance of risks and benefits as COVID rages on outside our borders and workers return home to their families. Currently, rotational workers can receive a test on day 5 of their return, and if negative, they can leave self-isolation at day 7. We are making an adjustment in this order, effective Wednesday, November 25th, where workers from a non-outbreak site within Canada will be required to wait until day 7 for their test. The benefit of this change is that it adds 2 additional days past potential COVID exposure, which will decrease the chance of a false negative test. If they receive a negative test, they can avail of a modified quarantine. They can leave their house and visit public places and other family members. They must wear a mask when in contact with people outside of their household bubble, even if that's other family members. They must not attend mass gatherings or crowded spaces and must not enter a long-term care facility, personal care home, or assisted living facility during the final 7 days of their modified quarantine. There will be some leeway here for exceptional circumstances. They must self-monitor for symptoms and call 811 to determine if they need testing. Any adults in the household of a rotational worker must wear a mask when in contact with others outside of their household bubble and should avoid mass gatherings, crowds, and visiting long-term care facilities, personal care homes, and assisted living facilities as much as possible. Starting Wednesday, we will also be making contact with these workers to see if they or their family require support in any way during this 14-day period, and also to provide them with a point of contact for any questions they may have around precautions the family should be taking. We encourage any rotational workers and their family to reach out to natural supports, such as family and friends, or avail of provincial resources, such as the Channel Warm Line, or Bridge the Gap with 2ps.ca. The same goes for anyone in the province experiencing increased stress or anxiety as a result of the COVID-19 pandemic. If we can contain the small clusters we have now and reinforce our defenses against new ones, there is every reason to believe we will be able to enjoy the holidays with our families. I truly believe Newfoundland and Labrador is at a tipping point. What we do now determines the COVID wave, if the COVID wave reaches our shores. We have seen from other jurisdictions that things can change quickly and take a turn for the worst. I know that many of you are watching the lockdowns and closures in other provinces and territories and wondering if that will happen here. It is entirely dependent on what happens with our provincial epidemiology. Province-wide closures like we saw in the spring are our last resort. Our first line of defense is isolated, regional, and temporary closures when we see an outbreak. There is no formula to determine what this may look like, as it is based on a multitude of factors. We can significantly reduce the likelihood of this happening if everyone can keep their close contacts to as few as possible. The fewer contacts you have, the less opportunity the virus has to spread. I also encourage retail establishments, particularly those with large capacity, to consider reducing the number of people permitted inside to allow for physical distancing if they have not already done so. As a recap, for those who may have just joined us, we have no new cases since yesterday's media, we have 2 new cases since yesterday's media advisory, and the total number of cases in the province is 321. Thank you to everyone that is listening, taking heed, and adhering to public health guidance. The coming weeks are critical in determining how our province fares, and we need everyone to do their part in pushing against this wave. So hold fast, and thank you, Newfoundland and Labrador.
Thank you, Dr. Fitzgerald. I'll now turn it over to Minister Haggie.
Thank you very much, Premier. Before I make my comments, I would like to recognize the fact that it's National Addictions Awareness Week this week. One of the group of challenged individuals during COVID-19 have been people struggling with addiction, and we have increased our level of services to try and provide access with minimal barriers through things like doorways and our regional hub and spoke model. But I would encourage anyone who is in a position where they think they may need help to call 811 or avail of these in-person services to access the services we do have. It is day 261 of the pandemic and our 101st scheduled media availability. Dr. Fitzgerald has documented an increase again in cases, and we've certainly seen a rise of quite some magnitude in our active cases. And we need to continue to do well. We have done well by any yardstick to this point. There is no magic bullet or secret sauce for protecting ourselves from COVID-19. It is a defense in layers. Those layers are the things we have talked about repeatedly and at length. But it starts with distancing and keeping your distance 6 feet apart. It's helped further by wearing a non-medical mask. It is helped even more by reducing the number of contacts outside your daily household. And we've seen figures from Dr. Rahman showing that 6 or less is a manageable number. And once you pass 11, the situation will rapidly become out of control. You avoid overcrowded places for that same reason and prolonged indoor contact whenever possible. But the key we have seen has been around travel, and that is the basis today for the changes the Premier has announced and the further changes that Dr. Fitzgerald has announced. When you move, the virus can move, and a mask will help you reduce that. Essential travel should be the watchword now. We shouldn't be moving around out of the province particularly unless there is some real pressing need to do that. The challenge that we have is the things that we introduce now, we will not see the benefits of for 2 weeks because of the nature of COVID-19. And the situation we find ourselves in now is not because of things that were done today or yesterday, but things that were done over the previous 2 weeks. And we have to bear that in mind. Getting away with it on the day is not what this is about. As Dr. Fitzgerald has said, when we do see clusters, because we will, the response of public health and government will be proportional and focused. We will do our level best, if at all possible, to try and avoid the blanket province-wide restrictions that we put in place at the beginning of COVID. We've learned a little bit more about it. There's still much more to learn, however. Some of the things that we have done over the previous months, you will see other provinces actually now starting to do. It's only within the last week or so that British Columbia has used mask recommendations for indoor public places and made that mandatory. That's something we recognized early on would be a help in protecting schools. And I would argue, compared with other jurisdictions, that has also worked. So others are catching up. On a higher level, strategic note, I received a letter from one of the opposition parties concerning the all-party joint committee on public health, and that will be reconstituted, and there is a meeting later on this week to enable discussions at an all-party level. So again, we have done well, but to continue to do well, we must continue to make the efforts that we've made before. This is a marathon, and this marathon will not end until a vaccine is widely available and in people's arms. And realistically, that is going to be towards the middle or end of next year. So we have to take a breath, put one foot in front of another, and plod our way through to the end of this tunnel. There is no way to sprint it. So listen to the advice from your public health officials. Take it to heart, and we'll get through this. And so with that, Premier, I'll call a halt there and turn it back to yourself.
Thank you, Minister. We'll now invite the media to offer some questions.
Thank you, Premier. For the benefit of our speakers, we have 7 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any further questions. Our first questions today are from Peter Cowan of CBC News. Please go ahead.
Looking at the rate of cases in other provinces, Nova Scotia has about the same rate as we do. PEI, for example, has half the rate of active cases right now compared to us. So can you explain from a science point of view why the risk, for example, of someone coming from Charlottetown, why they present a risk and need to isolate?
Well, I believe right now Premier King is announcing similar measures in Prince Edward Island, and there is some logistic issues of just getting from Prince Edward Island straight to Newfoundland and Labrador. But this is a preventative medicine measure that we're taking. I think it's balanced. The issue is not so much the exact numbers. It also has to do with the science and the epidemiology about community spread, in addition to the frank size of the numbers. So this is a preventative measure that we hope will prevent community spread in our communities.
This is very regional, though. Why not just bring those measures in for people who've been in the areas of the outbreak? And, for example, if someone has traveled to Cape Breton, where they're not seeing an outbreak, they're not seeing community spread, have different measures apply to them?
Well, I think this is the level that we've landed on that is safe for travel within the bubble. We're basically a bubble within a bubble. Patrolling and policing movement around other people's jurisdictions would be quite difficult, combined with the fact that, there is this lag period between being infected and developing symptoms. So because you're in Cape Breton today, you don't have symptoms. If you were in Halifax 3 days ago, you still may develop symptoms and you still may be infectious. So this is the measure, this is the firm, unfortunate measure that is balanced, in my opinion, to protect Newfoundlanders and Labradorians.
Our next questions are from Linda Swain of VOCM News. Please go ahead.
In recent days, we've seen municipalities having to take action to help control outbreaks. What was the situation there?
Well, I've spoken with Mayor Ball quite frequently over the weekend, and he felt this was extra measures that they wanted to put in place. I know he's had discussions with Dr. Fitzgerald, but this was out of an abundance of caution from the town of Deer Lake.
Any plans to implement point-of-entry testing or even perhaps random testing at airports or ferry terminals?
Well, the problem with point-of-entry testing, before I hand it over to Dr. Fitzgerald, is that it hasn't been proven scientifically to establish what we want it to establish. So it creates a false sense of hope for people who test negative. And in fact, when the studies that are coming out now suggest that it's point-of-exit testing of the time of quarantine, which is most effective. And we don't want to create that false sense of hope for people who would test negative at the time of entry. And you can't forget, there is a 30% false negative rate. And so if they're negative at the time of entry, that doesn't necessarily mean they are negative. In fact, there's 3 out of 10 people who would be walking around the community who would actually indeed be positive. So we've landed, and I'm quite proud that Dr. Fitzgerald has put together this protocol for rotational workers, which I think we're seeing as being effective, but is also supported by the science and the modeling, which is how we make our decisions. So, Dr. Fitzgerald, I'm not sure if you have a comment on point-of-entry testing.
No, I think you've covered it. We've always said that point-of-entry testing is just one point in time. It doesn't really give us any information about what can happen going forward. So we do not feel that it is the best place to use valuable testing resources.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Thank you, Kathy. I'm wondering about the elementary school. Can you clarify again, does the entire cohort, or in this case the whole class, have to self-isolate now for 14 days? How does that work?
Yes, so in general, if we have somebody in a class who tests positive, then that entire cohort would be considered close contacts of that positive case, and so would have to self-isolate, as any close contact would have to. In general, most cohorts are a class in an elementary school.
And when it comes to focus for regional measures, a place like Deer Lake, for example, has an airport, it's a crossroads, it's it's a fairly busy place with people coming, arriving, and leaving. How would you foresee any kind of a regional approach to Deer Lake should that become necessary?
So at this point, I need to reiterate that we don't have evidence of widespread community transmission in Deer Lake. All of the cases that we have seen to date have been, being able to be traced back to either travel or related to this cluster that was initially related to travel. So, at this point, we don't have what we call non-epidemiologically linked cases. So those are the ones that we're worried about. You'll remember we've talked about those before. When we have cases that we don't know where the source of the infection has come from, those are much more worrisome. So those would spur us on certainly to be looking at more restrictive measures. But at this point, we aren't there, and we're certainly not recommending those kinds of measures in Deer Lake at the moment.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm just looking to clarify on the, circuit break at this point. It's for 2 weeks. So for those from Atlantic Canada, they're not having to apply for an exemption form. So how are we going to make sure to monitor and implement the 2-week self-isolation?
So that's what we're implementing over the next day or so. So they'll have to self-isolate, no different than rotational workers coming from outbreak areas, and we'll be monitoring them, and hopefully we can trace them as best as we can as they come into the bubble, or to the Newfoundland bubble, I should say.
Everyone who comes into the province has to fill out a self-declaration form that asks them certain questions about where they're coming from and things like that. So we are able to track through that process who needs to be followed up.
All right, thank you. And when it comes to rotational workers, what advice do you have for those who share custody of children, and it may be their 2 weeks to have their children while they're home? In the case of they potentially testing positive, obviously nobody wants that, but if it's their week with their children, they want to spend it with their children, your advice?
Yeah, so they are still allowed to spend their time with their children. Rotational workers are allowed to isolate with their families. And that's why we added in some of the restrictions with regard to adult members of their family having to wear a mask when they're in contact with other people for those 2 weeks. But yes, that wouldn't change. None of these orders will negate any pre-existing custody arrangement.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
I'd like to ask how this affects agreements with the Quebec government for the issues at the Labrador border. Does this change measures that are in place for either on the south coast of Labrador or western Labrador, those measures that were in place?
It does. We are looking at before there was a bit of an open border between in southern Labrador, and so we're looking at having that border closed effectively and policed appropriately for 24 hours a day. And as I understand it, the job that's been completed in Lab West on the Quebec border has been a quite effective and efficient one, and they'll continue to do so.
So for residents of Fairmont or residents of Boulogne-Sablon, will they now have to apply for exemptions? How does this change practically for you if you're a person, say, who works in Lab City but living in Fairmont or something like that?
Well, you can apply for an exemption, but otherwise you have to self-isolate for 2 weeks.
Our next questions are from Elizabeth Whitten of All Newfoundland and Labrador. Please go ahead.
Thank you. Premier, is there any message you'd like to give businesses who are worried they're going to take another wallop after leaving the Atlantic bubble?
Pardon me?
Is there any message you'd like to give to businesses who are now concerned, because we don't have people coming in from these other provinces, that might impact their business?
Sure. The message is that we're trying to protect your businesses by giving this circuit break. We're enjoying we're enjoying this level of freedom, and we're the envy of a lot of other places around the country. We want to keep it that way, and we want other provinces within the bubble to sort out their epidemiology before we open it up again. So this is an effort to protect their businesses, to protect the economy. The last thing we want is a full lockdown, as Dr. Fitzgerald and Dr. Haggie said. So we don't want to get there. So this is a circuit break in order to protect the businesses, in order to protect the economy. And as I said, I would encourage and ask Newfoundlanders and Labradorians to support local during these times that are going to be tough. But again, this is just a 2-week pause, and it's in every effort to keep schools open and to keep businesses going so that the economy can continue on.
Right, and I just want you to clarify a point. This is a 2-week pause, so at the end of 2 weeks, do we rejoin the Atlantic bubble, or do you reevaluate rejoining the Atlantic bubble?
So we reevaluate the Atlantic bubble. Right now, I guess we're a bubble in a bubble, but we will reevaluate joining the Atlantic bubble in 2 weeks. I think it's, again, it's not the raw numbers of people that are infected. It's the type of spread that's occurring in other jurisdictions that people also have to be cognizant of and is weighing into the decision making. So we'll evaluate all that over the next couple of weeks and see where we are. But as I've said from day one, this is a dynamic, and Dr. Fitzgerald has said as well, one thing that we have learned in 2020 is that things can change, and they can change quickly. So we need to have the flexibility to meet the dynamic reality that is COVID-19.
Thank you.
Our next questions are from Sarah Smelly of the Canadian Press. Please go ahead.
I believe you're muted there.
Our next questions are from Sarah Smelly of the Canadian Press. Please go ahead. Okay, we'll go to Peter Cowan of CBC News. Please go ahead.
What are the standards that you're going to use in 2 weeks to evaluate whether or not that quarantine will need to continue or whether or not you'll raise it?
As we just mentioned, it'll be a combination of outbreak numbers combined with the epidemiology in the regions. So whether there's community spread being defined as having no index source that can be traced back, that's incredibly important. And I think people need to understand that is I'll turn it over to Dr. Fitzgerald in a second, but that's a key variable in the decision making. If there's a lot of community spread, then it's really easy to overwhelm the contact tracing. It presents a situation in which there's people walking around that don't know they have COVID-19 and potentially infecting others without any knowledge of it. So that is one variable in addition to the raw absolute numbers that are being seen within other areas of the Atlantic bubble. But Dr. Fitzgerald?
Yeah, so certainly we will be looking at what the responses are. So there are a couple of regions there are a couple of provinces, both New Brunswick and Nova Scotia, that have identified outbreaks, and Nova Scotia has been clear that they have some community transmission as well. So we will be looking at the levels of non-epidemic cases that they have. We'll be looking at the the trajectory of their case numbers. Are they going up? Are they going down? And looking at sort of a 7-day average, that sort of thing. Those are all things that we would consider with regard to whether or not to lift those isolation measures at that time.
We have 3 of our own little clusters in this province. How confident are you that these are contained right now?
So certainly in Grand Bank, it does appear contact tracing has been completed, and it does appear that we have identified all of the contacts to date. Of course, people who have been identified as contacts can develop symptoms, up to the 14-day mark. So we're not out of the woods until we know we've gotten through that, certainly through that cycle from the last known contact. But it does appear right now that we have identified those contacts and we have that area under control. However, things can change very quickly, so that doesn't mean you can let your guard down in Grand Bank. You still need to be careful, and it doesn't mean you can let your guard down anywhere, really. I mean, we still need to be watching out for physical distancing and making sure you're wearing your mask like you should be, and that you're avoiding gatherings and keeping your contacts as small as possible. And with regard to St. John's, that little cluster, again, it appears that it's that we have identified the contacts, but again, up to 2 weeks, we could certainly find more cases as a result of that. The good thing is that the contacts we've identified are in isolation, so there should be little further onward spread. Deer Lake, we're still working through that. It's still in early days, really. Certainly, we're comfortable with where we are now, that we've been able to trace everybody in this cluster back to that origin. That's very good. So, but it's still early days in Deer Lake.
Our next questions are from Linda Swain of VOCM News. Please go ahead.
Teachers have long been concerned about safety in the school system. Now that we have COVID in school, will there be any changes related to the wearing of masks, for instance? The NLTA is asking that masks be mandatory in schools, and extracurricular activities. How will they be impacted?
So, I don't want to speak for schools, but from a public health point of view, we have one case in a school, and we're certainly not going to create policy based on one case. So we're going to look and see what happens with this. We're going to follow it through. We're going to follow the investigation through. We're going to take learnings from that, if there are any, and we'll make policies that are measured and supported by evidence. That will apply to masks and many other things.
Why Wednesday before implementing this, removal from the Atlantic bubble?
Well, we need some time to implement the measures at the point of entry and to allow the public health officials to create the necessary measures to actually implement it. So it's just a matter of logistics and operations, I guess.
Our next questions are from Peter Jackson of The Telegraph. Please go ahead.
We may have had a case of a family member, a rotational worker, being around seniors. I'm wondering whether this recommendation is actually a hard and fast rule. Are families of rotational workers forbidden by health measure to enter long-term care homes?
No, so they're not. That statement is not a part of the special measures order. It is a recommendation that it be avoided as much as possible. Again, we're trying to strike a balance. We realize that if we prohibit people from going into long-term care facilities who are not the travelers themselves, that could cause hardship for care in these people who live in the long-term care facilities. So, we're trying to strike as good a balance as we can. We know that they have to wear masks whenever they're inside these facilities. They have to practice physical distancing as much as possible. They should only visit their loved one and not other people. All of those things would be in place. So we're asking that people avoid those situations, the families of the rotational workers avoid those situations, but we haven't restricted them in a special measures order specifically.
But just to be clear, rotational workers coming from an outbreak area themselves, outside of save their families, are not to be going into long-term care facilities.
The traveler themselves, the rotational worker, would not. That will be in the special measures order.
Okay, thank you. And one other question, Premier Furey, I'm wondering what the other premiers' reaction has been and what measures they said they might be doing.
Yeah, so we had a healthy discussion over the weekend. Premier King is implementing the same measures that we are here in Newfoundland and Labrador. New Brunswick and Nova Scotia are requesting for all non-essential travel between provinces to be stopped. We suggested, Dr. Fitzgerald suggested that last week for Nova Scotia in particular and Halifax, and you saw the media advisory on Saturday in addition to the message last week. So we've gone an extra step from Nova Scotia and New Brunswick, but everyone is gravely concerned about the spread and evaluating them from their own perspective. In this point in time, we have an added advantage of being somewhat isolated from the other Atlantic provinces, which I think we're going to leverage for our advantage moving forward.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I just want to go to the timeline. On Saturday, you announced that this festival would be happening, allowing 48 hours, which, while it's appreciated for programming purposes, I think a lot of the public started to jump to conclusions and panic buying began. Why not have held this on Saturday and given the warning with more days advance for the Wednesday's measures coming?
Well, part of it was we wanted to see the epidemiology of the virus in the other Atlantic region, the other Atlantic provinces evolve over the weekend. Of course, we had our own outbreaks here to deal with as well. So it was a combination of factors. It was not one in particular. And then, of course, weighing in on where the other Atlantic premiers were, so that we could have a consistent message to the citizens of the Atlantic bubble.
All right, thank you. And I just want to clarify about the man who had returned from Nova Scotia and St. John. The Digs on Freshwater Road had put out notice that they were temporarily closing as someone who had tested positive had been there. Others that had been there have been notified to that they don't have to self-isolate, but not to come into contact with others. It's kind of a contradicting statement for those who may work in healthcare or in the school system. What is the advice there?
Yeah, so we, Public Health did not order or ask that restaurant to close. The restaurant, I think out of an abundance of caution, decided to send out that notification to their clientele and staff. At this point, the contact tracing for that individual is completed, and anyone who is identified as a close contact has been advised to isolate and get tested. As with any situation, we always ask people to self-monitor for symptoms and to contact 811 either through calling or online, the online assessment, if you have any symptoms, to see if you need to get tested. And if they recommend that you need to get tested, then we certainly want you to go get tested. We only know about COVID cases if you get tested. So, that's the best way for us to be able to deal with it.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi again. Trying to get a sense of how many people have been affected by the cluster on the West Coast. How many people are currently self-isolating?
So I think I don't have all the latest numbers, because that process is still ongoing, and there is a class cohort that would be isolating now at this point. So that I'm not I don't have the final numbers of those, but there would be in excess of 20 to 25 people for sure now.
And in terms of is there a single straw that broke the camel's back here? Just looking for a clear answer on why this decision and why now.
The decision on the bubble?
Yeah, sorry, specifically.
Yeah, we were looking at numbers in New Brunswick, and we were looking at types of spread throughout Halifax and Nova Scotia in general, and those were some of the variables that were weighed in making this decision. And of course, the epidemiology from across the country as well. Different than in other provinces in the Atlantic bubble, you don't need an exemption to come in. You're supposed to isolate, albeit, but there isn't an exemption in place for the other three provinces. So all of these things were kind of weighing in when we made this decision.
Our next questions are from Elizabeth Whitten of all Newfoundland and Labrador. Please go ahead.
Thank you. I'm curious if this government knows how many people from the other Atlantic provinces visited Newfoundland and Labrador during the bubble lifespan.
I'm not sure. We can certainly arrange to have those numbers to the best of our abilities, but I don't have that off the top of my head.
All right, thanks. And to follow on Patrick's question on self-isolation, how many people are currently doing that, I'm curious, how many people are you currently waiting to hear the test results back on?
I'm sorry, there was an interruption in your question. Yeah.
I am curious, how many people are still waiting to hear back about their test results?
So The test results for the class cohort, of course, they've just been, testing has just been arranged for them today. So that's the main group. And then any contacts of these two latest cases that we have, we're waiting for test results for any of the contacts of these people. But other people, otherwise, we have all the results back.
All right. Thank you.
Sarah Smelly of the Canadian Press. We still have you on the line. I guess we'll go back to Peter Cowan. Do you have any final questions, Peter?
Yes, I do. How comfortable are you with businesses and municipalities making their own decisions about whether things should be open or closed? I know, for example, in Deer Lake, people said, well, gee, the arena is going to be closed and the town hall is going to be closed. Why aren't they closing schools? Things like that.
Well, of course, municipalities and businesses like the restaurant that we were just referring to often make their own decisions out of abundance of caution. I'm sorry, there's some feedback on the mic, Peter. Out of abundance of caution, and we can't control every business around them whether they should open or close their doors at this particular moment if they want to go outside an extra step of public health advice. But I will tell you, Dr. Fitzgerald has been in touch with Deer Lake and helped form how they kind of made their decisions. But they have their own buildings and their own employees that if they want to go beyond the public health advice, then that's an abundance of caution on their part.
If I can add, Premier, I would certainly encourage any community, any business who has questions, if they are in a situation where they've been identified as having cases, and they want to discuss any of these types of questions with public health. We welcome the discussion. The regional health authorities certainly are quite accessible to anyone who would like to reach out and have a discussion. We certainly are quite happy to provide public health advice.
I've got one more question just before I go on. I'll just ask whoever joined the line to just mute their microphone because we're hearing a bunch of feedback there. But you've said that the cases on the West Coast are tied back to a rotational worker. But when I look at the cases that have been announced, it doesn't appear that the rotational worker has actually shown up in our positive test there. Can you explain exactly what's going on there?
So not everybody gets tested in Newfoundland and Labrador. In this situation, and I don't really want to speak to specifics of somebody's individual case, but in some situations, the person may have gotten diagnosed elsewhere, and then we become informed that they are a case. And then, we take that information, we put two and two together, and we make the decision about where the exposure would have come from.
Okay, thanks.
Linda Swain, do you have any further questions?
Just one. Has the province seen many requests for travel exemptions leading up to Christmas? And if so, how many?
We certainly have seen quite a few travel exemption requests. I think before we made the decision about whether or not to expand the visiting over Christmas there a couple of weeks ago, we had 400 or so in the queue. And we continue to get a steady stream of requests. I can't give you the exact number, but we can certainly get that for you.
How many were approved, do you know?
Generally speaking, if they were just asking to come for a visit, then none of them would have been approved. But there may have been some with extenuating circumstances that might have fit into some of those exceptions that are in the special measures order.
Peter Jackson, do you have any further questions?
No, I'm good, thank you.
Kellyanne Roberts?
I have one. Are we still having the regular briefing on Wednesday, or does this take place with that?
No, we'll have an additional briefing on Wednesday.
And are we going to expect briefings to continue more frequently leading up to the update, or are we just sticking to one a week?
We'll play that by ear on the information and the frequency of cases and the requirement to update, but we'll certainly play that one by ear for sure.
Great, thanks. I'll save the school ones for the school briefing.
Patrick Butler, do you have any further questions?
Yeah, just a couple quick follow-ups on the Labrador border. Is the timeline the same for those 24-hour-a-day controls to go up on the Labrador border as well, so as of Wednesday?
My understanding was, and I'll clarify it if it's different, that was being implemented immediately, but I guess there will be some lag time in kind of operationalizing that.
And just on the Labrador border again, there aren't any cases in the Labrador the Grenville Health region right now. This is going to have an impact on border communities. Was there discussion over how you could limit the impact on Labrador and maybe not implementing these tough border measures, given there isn't really a prevalence of cases in that area?
We're evaluating everything, and we're looking at, of course, cases not just on the Labrador side, but on the other side of the border as well. And we think it's important, obviously, with the open border that you have to previously open border, you have to evaluate both sides of the border. And as we suggested, if there's extenuating circumstances like travel for health or other things, then there's availability for exemptions to the rule. But right now, given the prevalence and the incidents in some of the border communities, we think that this is the most prudent and responsible measure right now.
Thank you.
And Elizabeth Witt, do you have any further questions?
Yeah, I just wanted to confirm my math. We currently have 23 active cases?
I'll have to. Active cases, I have to say, it's something that we talk about in the media a lot. But for us in public health, active cases aren't it isn't the number that we're most worried about. We're worried about the cases we don't know about. Active cases we know about. We've contact traced them, and we've isolated their contacts. So I'll have to get that number for you.
Okay, because I remember seeing other people report over the weekend, 21 cases. 21 plus 2 today.
Yeah,
I want to say
well,
23.
it's certainly that I would trust your math on that, but I'd have to confirm it.
Yeah, it's being confirmed in the room here that it's 23.
Perfect. Thanks so much.
Thank you very much. Premier, do you have any further comments before we close today's briefing?
No, I'd ask everyone again just to be calm in the face of change, and please look after yourselves and each other, and together we'll get through this.
Thank you, Premier. For the benefit of our viewers and listeners, at 12:30 p.m. we will transition to a media briefing with the Honourable Tom Osborne, Minister of Education, Tony Stack, CEO, Director of Education of the Newfoundland and Labrador English School District, and Dr. Janice Fitzgerald, our Chief Medical Officer of Health. So if you would, all reporters would please stay on the line, and we'll transition at 12:30.
Good afternoon, everyone. Thank you for joining us virtually today. I'm joined by Tony Stack, CEO and Director of Education with the English School District, and by Dr. Janice Fitzgerald. You just heard Dr. Fitzgerald, Minister Haggie, and the Premier. I would like to thank them for their leadership during this situation and going forward. This morning, in consultation with the English School District, we made the decision to temporarily suspend classes at Elwood Elementary School in Deer Lake for 2 days, today and tomorrow, to allow time for contact tracing. This decision was made using an abundance of caution. This is the result of a positive test from a student at this school, which was confirmed just after 8 a.m. this morning. We took this step to ensure effective contact tracing is possible. In any public health investigation, if a student or staff member is considered a close contact of an individual who has tested positive for COVID-19, they will be contacted by public health officials. I've always indicated that there is no cookie-cutter approach to how we deal with COVID-19 in our schools, and I've said publicly on many occasions that any particular situation could lead to measures ranging anywhere from the absence of a student the closure of one or multiple classrooms, the suspension of classes in a wing of a school, or even the closure of a school or multiple schools in a region. Whatever decision we ultimately make, it is based on guidance from public health and consultation with a number of professionals. What we are doing here today is suspending classes in one school to allow for proper contact tracing with the best interest of the health and safety of our students, educators, staff, and their families in mind. This is the first time that we've had a situation in a school, and we want to ensure that the return to school plan we've put in place works properly and effectively. That is part of the reason for this decision today. Once contact tracing is complete, we will provide an update on next steps as it relates to this school. I know there is significant concern in the community of Deer Lake today, and I certainly appreciate that this concern gets amplified for people when their children are involved. My message to the community right now is to please let public health do its job and to please follow guidance from trusted sources. If we act together based on medical advice, we will get through this challenge and future challenges in the safest possible way for our communities. In closing, I want to say that I've had several discussions with the Premier as we dealt with this situation, and his guidance and leadership is appreciated as we move forward. So with that, I'll pass it back to our moderator, and we can answer your questions.
Thank you, Minister Osborne. For the benefit of our speakers, we have 5 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any further questions. Our first questions are from Peter Cowan of CBC News. Please go ahead.
Thanks. You said all along the strategy is to have students grouped into cohorts so that there's a limited number of contacts in this situation. So can you explain why you need to close the whole school then if the idea is that this one positive case should only have interacted with their immediate class?
Thank you for your question. The answer quite simply is that yes, this class is a cohort. This is the first time we've encountered a situation where we've had a positive test within the school, and we do have a great deal of confidence in the return to school policy and plan that was developed by the English School District and the department in consultation with public health and a number of officials and professionals. Because this is the first instance, I would rather that we acted with an abundance of caution than to look back and think that we should have. Because this is the first case, we've taken this action to ensure that all the measures that we've put in place in our plan and the contact tracing can be followed through and done properly and effectively.
Is there any plan to move to online learning for those students? And can you give us a status of what the Chromebook numbers are that were to be deployed across the province to students in order to make sure that they could do online learning?
Yeah. I'll ask Mr. Stack to answer that question, but I do know that we've had discussions today about assignments being sent to the students that are off today and tomorrow. Mr. Stack?
Thank you, Minister. Appreciate your leadership on this issue. So what we've done today, or what is taking place, is a suspension of face-to-face instruction. Teachers remain at work. So today they'll be preparing for connectivity with the student population. Tomorrow there could be activities. We're asking parents to be prepared for that connection outreach. and this is a good opportunity to test some of that in this situation. It's not a complete, full entry into a Scenario 3 model because it is only a couple of days, but it is an opportunity to do some connectivity and some testing, and for those students who are not ill are able to participate to the extent possible with their teachers. With respect to the Chromebooks, Chromebooks, by the way, are only intended for grades 7 through 12. So this is an elementary school, so the Chromebook situation is not impacted here necessarily. But to answer your question, we expect first delivery of Chromebooks the week at the end of this week.
Our next questions are from Brian Callahan of VOCM News. Please go ahead.
Thank you, and good afternoon, Minister and Mr. Stack. I'm wondering, given what's happened in Deer Lake, and I know you talk about the abundance of caution and being proactive, has any consideration been given to schools in Grand Bank before a case occurs there?
That question for me?
Well, either the Minister and Mr. Stack.
Not at this time. We're full confidence. We have a great interaction with public health. All of our regional headquarters are interfacing with the regional health authorities, and we've had timely information, and at this point there is no impact on schools in Grand Bank.
And with regard to the NLTA, of course, Mr. Ingram has made several statements regarding the latest cases, and he is certainly looking for further tightening of health precautions, specifically mandatory face masks in schools and physical barriers between students and staff or teachers. Where are we with those considerations?
Well, from a school perspective, we are following the advice of public health. So the public health directives with respect to mask wearing in schools are being adhered to.
There's been many, just on that note, sorry, not a third question, but there's many anecdotal and parents and that sort of thing saying that it's just not happening. I mean, it's impossible to keep the distance, and there's a lot of complacency with regard to face masks. Are you aware of this? Or are you content?
No, well, certainly we can reinforce those messages. I think any time that we have COVID cases in the province, it certainly highlights the concern, and we can emphasize, re-emphasize with our students the importance of mask wearing and put those key messages out to our staff to relay.
I think as well, just to expand on that, whether it's within our schools or within the general public, sometimes, because we've done so well and really the envy of many other jurisdictions globally, some people may get complacent. I think the fact that we're seeing a rising number, the fact that it's the first case in a school, it is a good time to confirm the need to follow public health guidelines and to ensure that we remain vigilant. We've done very well in this province, and we're going to continue to do very well in this province. The advice of our Chief Medical Officer of Health and Public Health have to be followed.
Thank you.
Our next questions are from David Barr of The Telegram. Please go ahead.
Thank you very much. I'm wondering if the two-day pause now that we're seeing in Elwood to allow contact tracing to take place, is that more or less the model that we can expect to see? Should there be any future cases reported in other schools around the province?
I can answer that and probably followed up by Mr. Stack. I've indicated several times that every situation is different based on where we are in terms of community spread, the number of cases in a province, the community that it's in, whether the community is more isolated or not. But in this particular case, this decision really was made by government in consultation with the English School District because we wanted to take an abundance of caution, simply because it is the first time we've seen a case in our schools, and we want to assure that the protocols and the plan that we've put in place and the contact tracing that everything will run as it should. We want to ensure, again, the abundance of caution. I think I'd rather be overly cautious than to look back and say, we believed everything was in place, we missed something. So we are using this opportunity, which is the first time that we've seen a case in a school, to ensure that everything that's in place works as well as we anticipate it should. Mr. Stack?
Thank you, Minister. So we have been interfacing with Dr. Dutt. Dan O'Brien, our regional director in Western Region, has been interfacing with Dr. Dutt extensively over these last few days. We have full confidence in the Regional Health Authority in Western, who have enacted rapid contact tracing notifications to families. There's no question that they've done so diligently, and notifications were out early this morning. And if any student or staff member is considered a close contact of an individual who is tested positive for COVID-19, they will be contacted by public health officials, and we have every confidence that that has taken place. If your child is not considered a close contact, then you would have been contacted. But out of an abundance of caution, again, this is the first time through for us. I don't think it templates how we react in the future. And as I've said, it also gives us a bit of an opportunity to run through some protocols around connectivity for students and reaching out, and we will use the lessons learned here and extrapolate them should we have to do this in another area, but it may not look exactly the same. For example, a suspension of classes for an entire school may not be required.
Thank you very much. Question for Dr. Fitzgerald. I know in the city of New York there was like a 3% positivity rate identified that kind of triggered the overall shutdown of their public health system. Public school system. I'm wondering if there's any kind of similar metric that public health is keeping their eyes on that could trigger a more widespread shutdown.
So there's no one metric that we're relying on. Did you say a 3% positivity rate?
I believe that was the metric in New York City, yeah.
That's quite low. So certainly, our positivity rate is even lower than that. But it's, that's one thing that we look at when we're looking at the spread of COVID-19 in the province. And we will also be looking at non-epi-linked cases. We'll also be looking at the rapidity of rise in cases, the number of contacts that people have in cases, that cases have. Those are all things, if we start to see that the number of contacts is going higher and higher and it's becoming more difficult to contact trace efficiently, all of those things will impact the decision as to whether or not we make any kind of restrictions, whether it be with schools or with anything else. So we can, at this point, we're not there, but those are things that we will always consider.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I guess this question is for Mr. Stack. The NLESB put out a notice from Dan O'Brien on Twitter yesterday regarding the case in Western Hills, saying that they advised the school district that there is no reason to adjust our school operations in any way at this time. This is just last night notifying for today's classes. So what changed in this less than 24-hour period?
Well, what changed was a positive case. So health have been, as I say, very proactive and very timely in their communications with our counterparts in the regions. And very early this morning, that changed. So that caused a set of decisions to be made very rapidly.
Thank you. And a testing site has been set up at the town hall in Deer Lake, a drive-through site more than anything. Do you still need an appointment to have these tests done out there if your child was a student at school?
I'm sorry, Kellyanne, I missed your question.
The testing site in Deer Lake at the town hall, there's a lot of cars coming through it. I'm just looking to clarify. You still need an appointment to get a test done, even if you were a student at Elwood Elementary.
Yes, you do need to have an appointment, but anyone who was considered a close contact in the school has been notified by public health staff about an appointment time for a test. So that those close contacts would have that information.
Thank you.
Our next questions are from Sarah Smelly of the Canadian Press. Please go ahead. We'll move on to Peter Callan of CBC. Please go ahead.
Dr. Fitzgerald, I'm wondering if you could walk me through what the contact tracing process looks like for a school. So we clearly know that the same cohort of whoever tests positive, presumably including the teacher, are all going to have to isolate and get tested. Give me an idea of some of the close contacts could be. So, for example, did this person ride the bus? Things like that.
Yes, so those are all things we have to consider. So first thing we look at, of course, household contacts. We know that this person traced back to clusters, so, this person was already isolating. So those contacts were low outside of school. The first thing they would look at it within the class, they would find out who was in the class. They'd get class lists. They would notify those parents of the children who were in the class. And then they would ask questions of the parents, and if they have permission from the parents to discuss the case with the teacher who may have some information about where the child may have moved in school, then they will do that. So then they may find out, if there's been any other teachers that they may have come into contact with, for example, gym teachers or music teachers, that sort of thing. They would ask about extracurricular activities and anyone they would have come into contact in that regard, anyone they may have played with that isn't in their class, those sorts of things. So those are all the questions. And then anyone who has been identified as being a close contact, so they would have fairly consistent exposure to the person, such as in a class or where you have been inside in close proximity for more than 15 minutes, not wearing a mask, that sort of thing. Those would all be considered close contacts, and they would be advised to quarantine and to get tested. So
there are parents who don't get notified that their child was a close contact, but they're still worried because they were in the same school. They're worried their kid may have, passed that other kid in the hall, things like that. Can they still get a test if they want to?
So we have to remember that, this virus, it does take a fair bit of exposure to pick it up. And that may be, we do have people who attend gatherings together. They're in the same space that may be poorly ventilated for a period of time. They may not be wearing masks. So in those situations, it's a little more easy for it to spread. If you're passing in the hallways, especially if the hallways are not crowded, which, I would think they tend not to be for most of the time in elementary school. But those are very low risk. They're very short periods of interaction, so they're not considered to put somebody at risk for COVID-19 exposure. What we will say is that anyone, who's been in school, and certainly anyone in the province really who develops to monitor for symptoms, if they develop symptoms that's consistent with COVID-19, then they certainly need to be tested. But, for someone who doesn't have any symptoms, who doesn't have a close exposure, then testing is not really warranted.
Our next questions are from Brian Callahan of VOCM News. Please go ahead.
I know that you mentioned that the positive test was confirmed just after 8 o'clock this morning, so I imagine a lot of students were probably already at school, dropped off, en route. How did the logistics of that play out this morning? Was it just a notice at the school and everybody was told to turn around and go home, or how did that work this morning?
My understanding is that calls were made very early, very rapidly this morning. We took at the prompting of health, provided class lists in advance of today, just in case, again, being very, very cautious. And those were followed up on immediately this morning. And the attendance rate was as well also low in the area. So my understanding is, now I don't have detailed information, and maybe Health have more, that the contacts were all made in a timely fashion. And there was one fortuitous bus delay that we're aware of that also helped in that situation.
Just not as a follow-up, but just for clarification, attendance was low. Do you know why that was, and what were the numbers or drop-off, and what was the reason for that, do you think?
Well, I would imagine it was apprehension within the community, understandably so. So the attendance rates were very low, less than 25%.
And as a second question, as follow-up, can I ask if consideration has been given to requiring staff, teachers, anyone who works in a school, whether or not it should be mandatory for them to have the app?
For them to have...
As another tool in the toolbox, you know?
The COVID app.
The COVID app. Oh, I see. I think, like anything else, we've the government of Canada, certainly the government of this province, have encouraged the use of the app, and we can help promote that for sure. But I don't know we can if there's any kind of mandatory way to check for that. A lot of personal phones in use and such, and really it comes down to a decision on the individual as to whether or not they're going to download that app.
I guess I'm just thinking of the seriousness here, and it's been repeated over and over by the government and everyone else who is aware of how this app works, that there are no privacy concerns. We've been assured of that. So I'm thinking about another tool in the toolbox and whether or not this might be necessary, given you're talking about closing schools, you know?
Well, from a district perspective, we can certainly promote the use of the app, for sure.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi, just one question for me. You're talking a lot about lessons that you'll learn from this situation. Any early lessons you can share about how this has been managed so far?
From district perspective, I think any time that we go through this process, we are the dialogue that occurs between our regional staff and the regional health authorities is good. You know, we solidify those contacts. We go through possibilities, but no, I can't land on any one particular lesson learned out of this, other than it cements the relationship and informs any future possible scenarios that we have to deal with.
Thank you.
Our next questions are from David Marr of The Telegram. Please go ahead.
Thank you once again. I'm wondering if you could speak directly to the parents of the province out there. What should they do should their child test positive for the virus? What kind of isolation measures should they set up at home? Those kinds of things.
Sorry, David, you were kind of faint. Are you asking what should parents do if their children become symptomatic? Is that the question?
If they, yes, and if they receive a positive result.
Oh, okay. So everyone who was identified as a close contact has been asked to isolate. So they would already be isolating right now. So for any of those parents, we want them to monitor the health of their children. If their children start to develop any symptoms, then obviously they need to avail of the 811 system, whether that's online or through a phone call, to determine if the child needs testing. And if the child does, then obviously we would encourage very strongly for parents to take their children to get tested, even if they have a negative test today. So because we know that a negative test on one day does not mean a negative test on another day. So even if people have a negative test today and they develop symptoms at a later date, they should still go and get tested again. Anyone who tests positive today with this round of testing, the same process will happen. We will start with contact tracing. We will identify all of their contacts and test all of their contacts. And, we'll make decisions then based on any information any further information that we get. But public health will be in touch with any of those, with the parents of any of those children who do test positive. And certainly, I think public health will be in contact fairly regularly over the next 14 days.
Thank you. That's it for me.
Kellyanne Roberts, please go ahead.
I'm wondering about the sanitization within the school now, where you're closed for 2 days, but teachers are in there today. So is the sanitization process for this particular classroom completed?
So at the end of every day, we go through our full deep clean routine in all of our schools. And in the case of Elwood Elementary, that would have been the case. So they would have shown up, all of the staff and students that were present this morning before dismissal would have encountered a clean school. And at the end of this day, and just like every other day, we'll go through that procedure again. All desks, high-touch surface areas will be cleaned as per our protocol that we have outlined with our return to school plan as coordinated with public health advice.
Thank you. And just one other one regarding the timeline with the 2 days close. Obviously, I know we're kind of making it work as we go through it. But is 2 days a realistic enough time? Do you not think maybe a week? And if after these 2 days, is it just that class that's still isolating and the rest of the school is back?
Yeah, I think, Kelly, we wanted to ensure that the protocols we had put in place, the connectivity between public health and English School District officials and the department, we wanted to ensure that everything was in place and operating as it should. We have confidence in the plan, but again, an abundance of caution here, I think is, as my grandmother used to say, an ounce of prevention is worth a pound of cure. Having said that, I think a week here would probably have raised anxiety levels within the community. And, while the public health and the chief medical officer of health and myself and the English School District will all say we have to become even more vigilant because we're seeing a second wave in other locations. We can prevent or at least significantly reduce that by being more vigilant. We have to do it in a way with our children that we don't create anxiety, because that in and of itself can cause harm to them. So, I think we reached the right balance with 2 days. I think a week probably would have sent the wrong messages.
Thank you.
Peter Cowan, do you have any final questions?
A couple of quick follow-up questions. Does this change anything around the policy around allowing extracurricular activities and outside organizations to use the school?
So, Peter, thank you for that question. We are, as we said when we released the information with respect to extracurricular activities, that we would assess on a regional basis. So as we speak, the folks back at my office are going through this right now, and we will consult, of course, public health as we always do. And if we have to curtail extracurricular activities in a particular area, and Deer Lake would be one that we'd be looking at, then we will certainly do that.
And a question for Dr. Fitzgerald. You mentioned in the break that active cases is actually one of the least useful measures to be able to compare provinces. Can you give me an idea, what are some of the numbers that are good as we're trying to compare the situation between the different Atlantic provinces?
So, on that, I don't want to give the impression that active cases is not something that, for the public that's a useful thing for them to know. It's just from our point of view, from our response, active cases are not really what we would be looking at from a public health point of view. We would be looking at, as I said before many times, these non-epi-linked cases. Those are the big ones that we worry about. We look at our our average number of cases a day, and we look at a 7-day average on that. We also look at our percent positivity in testing, and we can look at the RT at times. But none of these in and of themselves we wouldn't rely on any of them exclusively. All of them have their benefits, all of them have their drawbacks, and so that's why we have to look at all of them together and look at the picture together in order to determine what our actions will be. And then we have to consider things like healthcare capacity and public health capacity, which at this point is in the prevalence that we find ourselves now, it's not really something that we're worried about. But if we were to see more cases, then those would be two very important indicators for us with regard to tightening restrictions, that sort of thing.
When it comes to contact tracing, you mentioned, for example, there's now an additional 20 to 25 people in Deer Lake who are having to isolate, you're having to do contact tracing as these new cases come online. How much capacity do we have that we started to see a rise in cases that we'd still be able to identify and get those folks tested within 48 hours like we have been?
Right. So none of the people that are in isolation right now that are in this cohort need contact tracing except for that one positive case. So we don't do contact tracing until we know we have a positive case. And so I just wanted to clarify that. But if, we do have over 170 people who are able to do contact tracing in the province. And we have seen in Eastern Health, for example, when we had the large outbreak that we had at the beginning of the pandemic, that we certainly had capacity to be able to do that contact tracing that was necessary then. So, and we've had a lot of lessons learned. We know that, if we need to provide help from one area to another, we can certainly do that. We've also taken the step to engage with the federal government to have people who are trained in contact tracing as a backup if we need it. And we've also looked at training some people here in the province as well in contact tracing and contact follow-up. So, we are looking at increasing that capacity, just seeing what's happening elsewhere across the country. But at the moment, our capacity is good for public health and contact tracing.
Okay, thanks.
Brian Callahan, do you have any final questions?
Yes, thank you. I didn't catch the entirety of the previous briefing with the Premier, but I'm curious as to, I just wanted to know the percentage of PPE. What's the province's complement right now? I thought I saw a note that said it was at 80% last week, but I'm not sure, and I'm wondering if we're up to 100, or if not, why not?
So I believe the minister made that statement in our briefing last week. I would have to defer back to the department to be able to answer that question, Brian.
Okay, and thank you, Dr. Fitzgerald. I wanted to apologize off the top. I think I acknowledged the minister and Mr. Stack, but I inadvertently didn't say thank you to you as well. And my last question, I've heard from some substitute teachers who are asking, they say they were asked to complete training prior to working when there was a critical shortage. They did that start of the school year, and to date they say a lot of them have not been paid for the training, 3 months worth, I understand. And they're also worried that if we do go into a shutdown, that they're going to be left on the outside looking in, and they're worried about the so-called quote-unquote financial safety net, how the province will take care of them if that happens.
So on the payment for the training, first time that's been brought to my attention. We will engage at our level. We have a payroll division, but we also interact with teacher payroll in the province here in the building. So we'll look after that. We'll have it and then see where that is.
I guess in terms of what happens. It's a hypothetical situation. I know when we experienced the first wave of COVID, government had worked very hard to ensure that early childhood educators, for example, lower income essential workers and others, that we were able to assist them So if we get into a second wave, that's something that would have to be discussed with a number of ministers and the federal government as well to determine a way forward there.
Thank you.
David Marr, do you have any final questions?
Yes, forgive me if this is best kind of deferred back to the department, but Dr. Fitzgerald, I'm wondering if there's been any changes or increases to hospital capacity, to ICU capacity. In the God forbid the second wave doesn't indeed reach the shores, but have we had any increased capacity on that front?
Increased capacity in, I'm sorry, David, you were breaking up a bit. I had trouble hearing you.
Forgive me. I'm wondering if there's been any increase in capacity at hospitals and ICU, in the event the second wave doesn't indeed reach here.
Okay. So once again, I'll have to defer you back to the department. Perhaps you can send an email. I don't have that information. It's not really part of public health's domain. So.
Okay. Thank you very much.
And Kellyanne Roberts, do you have any final questions?
I do. I have one regarding cohorts using the same bathroom, where it's not possible to clean the bathroom every time after children from a different cohort uses it. So how does it work for contact tracing then in this situation?
So we would consider that to be very brief contact. Generally speaking, it's usually less than 15 minutes, and I guess if it's more than 15 minutes, hopefully you're in a stall. So it's not going to be a big issue from a contact tracing point of view. So, we don't generally go down that road when we're looking at contact tracing.
Thank you. And I have one other question in regards to students, but maybe not so much in this situation. But in regards to traveling home for Christmas, your advice for those who may live or may go to school in Ontario or elsewhere in Canada, but looking to return home for Christmas.
My advice for those people?
Yes, as they would be residents of the province.
I mean, certainly if they're coming home from Ontario and those places, then the expectation is that they will self-isolate as the orders have asked or dictated. And, it's really important to try to keep yourself as separated as you can from your family. And if that's not possible, then your family will have to isolate with you as well. If it's possible not to travel, then obviously that's the best option, and to avoid crowds and gatherings and all of those sorts of things that we've been saying all along.
Thank you.
Thank you, Kellyanne. Minister Osborne, did you have any closing remarks?
Just to thank Mr. Stack and Dr. Fitzgerald for being here today. Thank the media for joining in and getting the message out to the general public. And again, I know Dr. Fitzgerald and Minister Haggie, the Premier, have said it earlier in the briefing, and every time they get the opportunity, but just urging everybody to be more vigilant, to start exercising more vigilance when it comes to following the guidelines of public health. As Dr. Fitzgerald said, we can significantly reduce the numbers of cases in this province that we've seen in other provinces if we do so.